Today we're going to talk about the 5 common mistakes that you could be making that can make your L4-L5 disc bulge disc herniation worse. And not only am I going to talk about the mistakes, the problems, but I'm going to give you some solution and tips to help correct it. Now I'm going to warn you, failure to watch the video to the very end and keep making these 5 common mistakes could not only slow the rate at which you heal, slow the rate at which you get your life back, could allow that disc bulge to get into a huge herniation and possibly lead to surgery. So please watch to the end and learn from this information so you can live stronger longer. An example, I've been taking care of patients for over 30 years, and I have patients that get out of pain relatively quick. But remember, pain will leave long before you're healed. And so what happens is they don't continue with the rehab exercises, they go back to the gym, they go back to work too soon, and guess what? Not only slow their progress down, but now they have a crisis, and sometimes that can even lead to a surgery. So don't be like that patient that doesn't follow through with my recommendations. Also, if you like this information, like it and share it. And then at the bottom, let me know very simply that you have liked it so I can make a comment on this. I'm Dr. Gregory Kramer. I'm a Livonia chiropractor with over 30 years experience. I've seen over a couple 100,000 office visits. And I'm certified in corrective care with chiropractic biophysics. And I specialize in chronic degenerative spinal problems like L4-L5 disc bulge, disc herniations, auto accidents, and other sports-related traumas to the disc and ligaments. My 3 main choices to help people are spinal decompression, corrective chiropractic, and targeted specific exercises. These are tools that I use to help people eliminate pain, stabilize their spine, and avoid spinal surgery so you can live stronger longer. And again, if you like this information, like it and share it. The number 1 most common mistake I see with people that slow down the healing process of an L4-L5 disc bulge or disc herniation is adding strength training before correcting any structural displacement. That's like putting a big engine into a bent frame. It doesn't make sense. If your tires are out of alignment and all you do is drive the car faster, you're looking for disaster. So the solution is you need to find an expert that can measure you and see, do you have a large structural displacement? And if you have a large structural displacement, you need to get that corrected first before you add very valuable strength training. Now, mistake number 2 is this. Wait for a crisis. Do not wait for a crisis. Your body, most of the time, not always, most of the time will give you a few clues that you've got a small problem. Fix small problems before they become huge problems. Small problems turn into bigger problems, bulges turn into herniations, and eventually small herniations turn into huge herniations that might require surgery. So again, don't wait for a crisis, okay? Fix small problems before they become too big. Number 3, the number 3rd problem is not understanding that your pain relief is not the same as complete healing. Don't quit the prescribed targeted exercises. Most people quit too soon. They're out of pain and they quit the exercise. And the solution is follow through. Complete all the targeted exercises for the duration that they're designed for. You won't need to do everything the rest of your life, but you'll need a few for maintenance. So again, remember, pain relief comes long before healing has occurred. So follow through with your exercises, okay? And number 3, very simple. Do not return to work or heavy aggressive exercise too soon. I have countless patients that very simply they go back to heavy lifting, particularly if you have to lift below your knees. So it's one thing if you lift above your knees, but it takes months, sometimes a year, for the ligaments and discs to heal. Now, in my previous videos, I talk about the common sense exercises you can do along the way, whether you were 30 days from a disc bulge or herniation, 60 or 90. Now, when I was laid up and I went to the hospital because I had a blown L4, L5 disc, I missed maybe a week of gym. But I wasn't out of the gym for months. No, there's always something you can do. Push-ups, chin-ups, there's a variety of things that you can do, but they gotta be slow and controlled. So again, do not rush back to heavy exercise. Do not try to drive the ball as far as you can playing golf or being aggressive with tennis. There's mild to moderate ways you can do all kinds of sports, whether it's golf, tennis, martial arts, wrestling, lifting weights. There's a mild version of it. So start slow and give your body the appropriate time to heal. The next thing is very simple, is making sure you obtain a maintenance concept. So again, we talked about that you got to correct the structure first. We talked about don't wait for a crisis. We talked about don't quit your exercises. We talked about return to work. Now we're going to talk about you need to develop a mindset of preventative maintenance. All right? Almost every health problem, from heart disease to cancer to disc problems, is due to a lack of maintenance. Okay? Listen, you guys do regular maintenance on your teeth. You do regular maintenance on your car. By a show of hands, how many of you would fly in a plane if the plane only did preventative maintenance after it crashed? None of you. The key to preventative maintenance is to prevent a crash. So apply that concept to your spine, your disc, and you'll have a much happier and a much more pain-free and highly athletic life. Now, if this information makes sense to you, if you know people are suffering from L4, L5, and they constantly re-injure themselves, send them the link, okay? Like and subscribe. If this information helps you, let me know. In fact, it's your turn. Tell me, what have you done in the past to not only get well, but if you had some problems, have you slowed down the healing of your L4, L5 disc bulge or herniation? What have you done to kind of create a flare-up? Okay, I've heard all kinds of things over the last 30-some years. So again, if you want to eliminate pain, avoid spinal surgery, stabilize your spine so that you can live stronger longer, subscribe, like it, and share it. Now, if you like some exercises that I think will help you eliminate back and leg pain, sometimes immediately, just look over here to the right and you'll find all kinds of exercises that will help you, again, eliminate pain, stabilize your spine, avoid spinal surgery so you too can live stronger longer.